Hello and welcome. I'm Raymond Arakasel. As you said, this is the Care Africa Medical Foundation Health Center. The health center was open to the public in May this year, 2025. And we started by providing free medical health services to the community because the purpose of the health center actually from the vision and idea of the founder was to provide, health services to the unserved community. And being that she has lived in this community for some time, she decided to return and at least help the people of Grand Baza and all of the other communities around. And we started, we begin to provide free community outreach to the community as well. We have started with a lot of communities already and carry on community outreach, health education, and we have been talking about being the silent killer, which has to do with the hypertension. So we go in the community, we do the vital sign for patients and all community dwellers, especially from the age 40 up. And we also do the blood sugar testing, and we provide some counseling for them as well and give them some medication. And when they are in the crisis stage, we refer them to the community, the facility. The facility, since we open, we actually, the community dwellers have been accessing the services of the community or the facility here. And they are certified because our facility, I'm not boasting, it is up to standard. Though we know all of the resources are not available, we're still looking for other resources, at least to meet up with the prevailing, or situation on hand. But right now, our lab, if you visit our lab, you realize that we have all modern diagnostic equipment, which we do in various tests. And we have qualified staff here in various departments, like the mother and child health, the emergency department, in the lab, as well as in the pharmacy. We have people, we have doctors, we have physician assistant, and we have all the qualified staff working along with. Okay, so this is the finance department, and this is one of the staff. She's the supervisor for the finance department.
My name is Veronica Johnson. Welcome to the finance department. This is where we receive all of the payment, and some can be done in mobile money. We got Lone Star and Orange. It can be paid. We also receive the insurance documents, and we take down our record and put it down. When it comes to finance, like the payment, the challenges we are facing here is that you find out that the patient will complain when you bill them, and because of that, we always having that mind that if even they are angry or what they say, we are there to calm them down and tell them that you have to pay this based on the test, the lab you are going to do, and it can be okay at times.
It's the laboratory here where we do all of our tests. Yeah. So you're welcome. You can come in and the laboratory here where we do all of our tests, and this is the supervisor for the lab.
My name is Ricky Alamade. I'm the lab supervisor of Care Africa. And in this lab here, we do a lot of tests. This is our collection site. We have various departments in the lab. We have our collection site where when the patient comes in, they have the seat. We work on them, we collect the lab form from them, and then we collect their sample. And we take it to we have the centrifuge, which is on the other side there where we spin our sample and take it to this department here where these are our chemistry analyzer where we do our liver function, kidney function, lipid. And this is another analyzer here where we do the thyroid test to check for cancer. We do the PSA, the prostate cancers. and we do the sugar test also. And this our ESR machine, our CBC. This is a complete blood count where we do the entire body scanning. This is our fridge, our blood bank, where we place our blood for transfusion, and you have our reagents here for our chemistry machines. This is our laptop and our printer for our results, where when the machines are put all the results, we do the printing of our results and give our results. And I can assure you with Care Africa, with this lab here is one of the best lab within Grand Bassa County, because in terms of structures and a lot of tests that we do in this place, I don't see any lab in this Grand Bassa. So with this lab, you can come and do all your body checkup, and your health problem can be solved with this facility and this lab, because we do all body tests, we do any test you think about, we do in this facility. The excitement is the care. We give them the care when they come. We work on them, the care, and how we interact with them.
So this is the pharmacy, and do all of the dispensing of medication here. So you're welcome. You can come in, and this is our dispensary, and back there is where we have all of our drugs and come straight to the dispensary, and you dispense from here to the patients. That's what we do. Serving a patient. Yeah, she's serving a patient right now.
Gabriel in feature money. Well, our work is very perfect. We do one stock. You come, we can give you paper to go anywhere else to go buy medication. You can do your registration. After your registration, you pass through the lab, the doctor see you, come to the pharmacy. When you finish with your drugs, you dispense your medicine, then you go home.
So when patients come here, do they pay for medicine, or is all within the bills?
Everything can be in the bill. Yes, I'm also slim. They often use for most patients in cases of infection is an antibiotic. Ampicillin. Yeah, we got the malaria medicine, PCM. We got a pin tablet and a pin rub. Yeah, this is our storeroom where we store our drugs. When if on our side, then we can bring everything on the side. From the drugs, especially the rabies, the tetanus, and some injection there for OB. We is the pregnant women.
So you are welcome in here. Uh, this one of the registrar. You can see her now doing the vital sign of a patient to the recording.
So please come on the stage. Thank you. You can please have a seat. So we are going out there to sit. We are going out there to sit to where the OPD can be. Next, after you are going to see the title, I will follow you with your chat. Thank you so much. You can leave.
This is the consultation room number 1. Yeah. We going in the emergency room. This is the bathroom for the patients. So this is the emergency.
My name is Omaria Skate here. We do inpatient here. There is a ER. When you bring our emergency patient, we receive the patient here. When we get to receiving the patient, when the patient is stable, we get another department on our side, peace ward there, where we put the children, the adult ward. We even get a recovery room on our side when the patient is more stable to be discharged. Then we get a female ward there too. The male ward also. So we do a lot of things here. And another important thing we do here, if you don't have the money, we don't prioritize the money. Patient first, the money last. Typical example with a student that just come in here right now as an emergency. She's lying in bed. Yeah, she came. The parents is not around. The institution just brought her, but we're carrying out the entire process. Money last. That is the motive of Care Africa.
My name is Venus Enima Founder Salvation Army Bramwell Booth in New Buchanan Block Hill. I was on campus writing my text. After writing my text, my friend sprayed in a class. I said I smell the spray saying I feel off. First, the people look at me, they ask me for money, they treat me well, and now I'm going through. Right now my mommy is not around. My father said he's not around, he's fired.
So we are about to enter the inpatient building, the building that consists of the mother and child health. And this building also has the operating theater department. It has the male ward, it has the female ward, and it also has the peace ward as well. So we are welcome. You can come in.
Princess L. Davis. For here, we do ANC screening for our OB patients for the outpatient department. This is where we do the ANC screening for them, and then they go home. Antenatal care. So here is the female ward, but we also keep postpartum mothers and their babies here when the pre-labor ward is full. And we also keep patients from the ER2 as well here.
Welcome, and this is the counselor office. And as you see, all behind her desk, she counsel some patients and patient relatives.
My name is Gabriel Salo. I am a physician assistant and I serve as the officer in charge of Care Africa Medical Foundation Health Center. So basically my role here is to make sure that staff do the work properly, making sure that the services we provide are being appreciated by the community. And so we make sure that our staff are up to date in terms of protocols, making sure that they understand the national protocol of Liberia so that we don't breach any protocols. So we monitor them on a daily basis and they are doing pretty well, making sure that their patients come first. Our goal is to give quality and affordable healthcare to the people of Basel and Liberia at large. Yes, so our services is not different from other services. It's just about the passion we come with. We run an outpatient department. That is, if you come from out, you meet a doctor, see the doctor. We also have an emergency. We also have a laboratory. And one of the key strengths of our facility is the lab. Because if you look at Basel right now, there are facilities who are doing their best, but then when it comes to the kind of lab they provide, we are leading in terms of that. So we're serving as a buttress for Liberian Government Hospital, for example, which is not even doing chemistry tests right now. They are not doing electrolytes. So why they should, they are the first, and we respect them. But then when it comes to helping them as it relates to maybe doing electrolytes tests, they can refer to us and then we'll do the test and then send it back to the Liberian Government Hospital where the doctors can be able to see the patient properly.
Prince James K. Jr. is my name. And welcome to Care Africa Medical Foundation Health Center, located on your own road. I'm the office manager / finance officer for this institution. Basically, the dual position for the office manager, my responsibility is to make sure that all of the offices are in good health as it relates to whatever supply they need for the institution for them to function properly. from the medical side to non-medical office. And as the finance officer, I oversee all of the financial transaction, prepare payroll, and that'll work on bills from the insurance side, everything that has to do with finance for the institution. One of the unique things that I think we have advantage is that as the issue of treating people without even telling you about money, we prioritize the life, the health of the patient. So, for example, normally in Liberia, when somebody is ill, in the rush of emergency, you are able to ask them to do deposit. And for us, we are not in that path. So we make sure that you are stabilized first before asking for money. So this is one of the advantages that we have in Green Bansa. And for our labs, the equipment will have modern equipment. You don't have to leave Ikano to go Monrovia. So if you want to do your full chemistry, you want to do your cholesterol, you want to do your kidney test, we can do all of the tests in our facility. This is one of the advantages that we have. And the third one has to do with patient care. From the security to the highest person you meet in this institution, we care for our patient. Patient satisfaction is our first priority. And this is one of the things that is lacking in the health sector in Liberia.